Welcome to Black Health Matters. I'm Daryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Tools to track your health at home. And I hope everyone has a blood pressure monitor, which I think is absolutely critical. They also recommend that you have a thermometer so you can take your temperature uh, so you know whether you have a fever or not. And they also recommend some other things that we've talked about before, especially getting hearing tests to find out whether you need hearing aids or not. And then, of course, a bathroom scale so that you can weigh yourself daily or at least weekly, once weekly. And then, of course, ways in which you monitor your exercise. Those are kind of tools to track your health at home that are easy to get, but I think very important and not particularly expensive. So, anyway, I just thought that I would add that to our discussion today. Any comment about that before we start on the articles?
Only comment I have is most of what you named, you can do on a smartphone or smartwatch.
Well, they don't say, well, what you do it on. They just say that you need to have it. So, yeah, if you have it on anything that you have, then that's fine. All right. Because most people may not have a smartwatch or smartphone. Okay, John, I guess we can start the articles. Yeah, this is an interesting story about a woman who actually had chest pain. Shoulder pain, left arm pain, and went to the hospital, and they had difficulty because she's only 24 in making the diagnosis. And this story talks about how that she was screaming of pain and took her to the hospital, but they because of her age, they felt that you didn't really have a heart attack. And studies demonstrated that, in point of fact, she did have a heart attack, and that because of her age and also the fact that she's white, dissuaded them from believing that she actually had a heart attack, but she actually did. And so that you can have a heart attack in the 20s as well as older. And they also identified that she had some unusual heart situations that made her subject to have this unusual heart attack. But the bottom line was that she had the pain, but it was in her shoulder, in her arm, wasn't in her chest. And because of her age, they missed the diagnosis at first. And this goes back to what our speaker last week was talking about, that women may have pain in places other than the chest, and have it in the neck, and have it in the shoulder, the arms, or the hand, the jaw. So this is an interesting case in which this, not only was she a woman, but she was only 24 years of age.
I had a question, Dr. Callender.
Yeah.
Troponin. I've never heard about that before.
Yeah, that's the blood test that they give that demonstrates that your heart muscle is damaged. Troponins. That's the one test that they do that identifies that the heart is damaged. Troponins. Yeah. Yeah. And that's the test that made it clear to them that she was having a heart attack in spite of reasons for not believing that she had a heart attack. in patent pulmonovalle, PFO, is where you have a hole in the heart that allows blood or clots to go from one part of the heart to the other. Any other questions about this?
One thing, 2 pictures I've noticed so far, she has a cell phone. But another thing I noticed that, did they say anything because she was a female that they didn't think it? They'll look at
No, it's her
males that
age. It was her
Huh?
age. It was her
her
age.
age, but they didn't look at what sex she was.
No, it was the age that fooled them, not the age and where her pain was in the arm. Those are the two things that confused them. She had no chest pain.
Okay, what I'm saying, yeah, you've heard of young athletes, men particularly, they're in sports and they expired due to heart attacks in their 20s. So
Well,
why was this an age for her?
Well, that's a different situation because that's not a heart attack. That is really just the cardiac arrhythmia and other things that kill them because probably the commonest cause of death is arrhythmias, which means the heart stops beating or has an abnormal rhythm that is not associated with the heart functioning normally. So that is not really a heart attack. When we talk of a heart attack, as Dr. Capers talked about last week, they're talking about a blood clot that blocks the blood vessels that go to the heart. And for what you're talking about with the young athletes, most of them, they don't have a heart attack, they have a arrhythmia. Now, you may say that anything that happens to your heart that kills you is a heart attack. But traditionally, when they talk about a heart attack, they're talking about a blood clot that blocks off the coronary arteries. Whereas what kills these young athletes is not the heart attack usually, but it's the dysrhythmia, where the heart rhythm is abnormal and heart stops beating.
Yeah, I think it was a Baltimore Ravens football player last year that, as you say, he didn't have the myocardial infarction caused by a blockage, but he had the dysrhythmia where his heart stopped on the field.
Right. Yeah, that's the commonest reason why you're right. Male athletes drop dead, so to speak. I was thinking of Darrell because they had a young man who dropped dead after a marathon, and because they were alleging that death after marathons is so rare, but as Darrell had indicated, it goes way back in history to where the original marathon runners dropped dead. So, so there are many reasons why the heart stops beating. But in this case, this lady's case, it was a heart attack.
Yeah.
So what is
With
it
marathon,
called when a man dies during sex? Is that a heart attack or arrhythmia, whatever?
That depends because I don't know. You'd have to do an autopsy to find out whether they had a heart attack. For example, many of the patients that I know of who have heart trouble, but most of the sudden deaths that occur in younger people are arrhythmias. In older people, it may well be the blocking of the coronary arteries.
Recently, we're hearing about heart attacks in different areas of the body. I think a few sessions ago, we talked about heart attacks, and on TV is always the chest. Well, today, here we are with the arm. And recently, I know of 2 people that had a heart attack, had a stomach ache. Could it be anywhere, back or
Well, yeah, it could be any, just as you mentioned it, and I think Dr.
Yeah.
Capers mentioned as well last week that indigestion, some people think they have indigestion, which is
Yeah.
really a heart attack. And so that it can be the back, it can be the jaw, it can be the shoulder. It seems that with women, it is even less likely to be in the chest. It can be, while it can be the chest, it's still even more likely in women to be in other places other than the chest, as you pointed out, the indigestion, which is a heart attack to proven otherwise, or in the jaw, on, as you mentioned, the arm. So,
Mhm.
yeah, you're right. There are many locations which can be associated with a heart attack. Any other comments about this very interesting article? And points out that heart attacks can manifest themselves in different ways, regardless of age and gender. Okay. This is an article that talks about women being less likely to receive a liver transplant because of the size of the liver and whether you have a liver that's coming from a large man or a small, short man or a woman, and that the reason why less women receive liver transplants is because the size of the liver may not be compatible with them. And that's 8% is not a whole lot, but it's still a significant number. That's interesting because the liver, the size matters, whereas because you have to fit it into the abdominal cavity with the kidneys and the other organs, the size doesn't matter as much.
It seemed a little strange, less likely to receive. And I remember with David's first transplant, it was a woman. He received an organ from a woman. And we're talking about a woman receiving an organ. She receiving an organ herself.
Right, because
Yeah.
it talks about the size of the liver, and sometimes if it's a man, that the size may be too large for the woman.
Right. And I think that's how he got a woman's his first transplant was in 96, and he was a small framed man, and he received a woman's liver.
Any other comments or questions about this disparity?
Yeah.
It's interesting because women are most likely to be donors, but less likely to be recipients
Yeah.
of transplants.
Dr. Calendar, what happened to the process of where a part of the liver is transplanted and it's regenerated? Is that still going on?
Very much so. Yeah.
Mhm.
At least hundreds of livers are donated in that fashion now, so that one liver from a deceased person can go to two people. And you can give a living donor can give part of his liver to his or her liver to someone else, because the liver, as you pointed out, the liver can regrow itself.
So this only is for when whole livers are transplanted, right?
Yeah, this article is talking about whole livers. Yes. Okay.
I know when John got his liver, the first time at Howard, well, only time that they couldn't, they couldn't completely suture him up. It was either because he ate too much watermelon or was it because the liver was too large?
Well, I don't remember because that's more than 30 years ago. I don't remember. I remember we did have difficulty closing him and that it may have been a combination of factors. I was talking with Mr. Yeager the other day, and we were remembering the circumstances under which we finally located John. And remember, he was out having a good time, and that may well have contributed to why we had difficulty closing him initially.
Yeah, we were at a church-wide picnic and he won a watermelon eating contest.
Yeah, it probably contributed to it.
Yeah.
Curtis and I were talking about how interesting it was to the search for John at the time, and it involved all media to try and locate John, and they finally did, and it was an interesting celebration.
Right, and they've never done that since, have they?
We haven't had not that I know of, because now we have the cell phones and we have ways to communicate that are much more effective, so that you can't get lost like you could then. Remember the pages we had were very local, so to speak. It was hard to find people. And now the resources are so much better that if you want to be found, you're going to be found quickly.
Right.
This is an article about the new COVID strain, and the good news about it is that the vaccine that you'll be getting in the next month or so is able to address this variant. There are a number of variants that associated with the new COVID strain, and that's why one of the things that is important is getting the 24 version of the COVID vaccine, which is able to take care of the new COVID variants.
Good morning, everyone. Friend of mine recently got COVID, and he said that this particular strain that's out now has one of the side effects is that it spikes your blood pressure. Do you know anything about that, Dr. Calvin?
No, I don't.
He says that they actually have him monitored, so when his blood pressure goes up, they can get him to the hospital. They'll send to get him to the hospital, because he said that that's one of the side effects of this new strain. So he was encouraging us to make sure you get the vaccine when it comes out, because
and it's out. So and now's the time. The best time to get the vaccine probably is late September or October. And also remember, for the flu vaccine, to get the double dose if you're over 65.
I'm reading something from the American Heart Association that says an analysis of more than 45,000 people infected with SARS-CoV-2, the new strain, found a significant association between the virus and the development of persistent high blood pressure among those with no prior history of high blood pressure.
Thank you.
yeah, that's exactly what he said. He said his blood pressure shoots up. You know, and they have him monitored so they can get him right to the hospital.
Right. So it's important to have a blood pressure monitor and to detect the pressure. Some recommend twice a day at the same time, so that you can find out if your blood pressure is
He
normal.
said he's supposed to monitor his 3 times a day. But even if he doesn't, he said the hospital has some monitor, and they monitor him and send somebody to get him. I guess he has some good connections.
Good morning, Betty. Question for you. So they've got to get him to the hospital right away. Is that to prevent him from having a stroke?
Yeah,
Yeah,
yes,
stroke, heart attack, something.
the
But they-
stroke, yeah.
And he lives in the New York area. He actually lives in New Jersey, but so I don't know whether it's a New Jersey hospital or probably a New Jersey hospital. But anyway, he's a minister, and he said he was getting ready to go to church one Sunday morning, and they called him and told him to just stay put because they're sending somebody to get him because his pressure was up. So yeah, he's been battling it. He caught COVID in July, so he's been battling it since July.
So he's got long COVID, right?
Yes.
Okay, thank you for sharing. This is an article on how you can help yourself fight off the flu. And it's talking about traveling on crowded buses, trains, Christmas shoppers, and people coughing. And it emphasizes that washing hands, masking, and staying away from people who are infected becomes important. It's also important to realize that the flu kills even more people than COVID kills, and so that getting all of the vaccines that you need to get are important. The flu, the COVID, and the RSV, especially if you're over 65, and that staying apart, washing your hands, wearing a mask, some of the things that are very important. And then, of course, getting the appropriate vaccines.
There again, my husband and I got the RSV vaccine, what, a week, 2 weeks ago? Anyway, maybe about a week after, and I really haven't been out that much, but maybe about a week afterwards, I got a cold. So I'm wondering whether it had any association with the RSV vaccine.
Well, a cold is not.
Well, I think it's a cold. I don't know.
Oh,
I
okay.
haven't had it.
I can't answer that question, but I think the RSV is associated with infections in older people that it becomes lethal. So that if it's just a cold,
So far, it's just stuffiness, and I'm not achy or anything, but I do have a lot of stuffiness. Head cold, basically.
okay.
Yeah.
The CDC says that RSV vaccine is not currently an annual vaccine, meaning people don't need to get a dose every year. But it says based on clinical trial data, one dose of RSV vaccine can provide protection for at least 2 years.
Yeah, although they are recommending, it's interesting, CBC also recommend that get RSV annually. It's interesting that you have that, because when it originally came out, that's exactly what they said. But I noticed the CDC in its release in June indicated that RSV and flu and COVID should be gotten.
I have a question,
I
Dr.
do.
Calder. Is it advised to get all three at the same time?
No, it's advised to, you can get the COVID and the flu at the same time, but it's not advised to get all three at the same time.
And you mentioned the double flu shot for old people like us. Is that 2 shots or it's just
One shot that's doubly potent, and you have to specifically ask for it if you're over 65. Didn't say old people because over 65, is not considered so elderly as people like me are over 85. We're elderly, but you younger people who's 65 and above, though, you should get a doubly potent shot. And sometimes if you don't ask for it, they won't give it to you. So remember to ask for it.
I will.
Yeah, we got RSV last year and again this year, so.
Yeah, it's interesting because, as Darryl said, when they originally came out with it, they said one shot maybe for 36 months, but interestingly, the more recent release, CDC in June indicated that the 3 vaccines were recommended for the fall, which we are now in. Will treating high blood pressure curb dementia risk? There's a lot of evidence that is the case, and that is one of the factors that is one of the many modifiable factors that 60% of the dementia is thought to be modifiable or preventable, and correcting your blood pressure is one of the modifiable factors, as well as correcting your diabetes, correcting your blood pressure, your diabetes, your cholesterol, and there's at least 10 risk factors that are associated with being normalized that would decrease the likelihood of dementia. Although that's 60%, but there's still 40% that occurs for reasons we are unclear on. So it's pretty clear to most that keeping your blood pressure below 130/80 is important to prevent dementia. Still having a lot of discussion about whether 130/80 or 120/80, but 130/80 seems to be the target right now. It changes from year to year, but right now. Dr. Perez.
Type 3 diabetes.
What about diabetes?
No, the slogan type 3 diabetes associated with dementia, obesity.
Oh,
That term.
I see.
Well, I'm familiar with type 1 and 2 diabetes. What's type 3 diabetes?
I think she just told you. You want to say it again, Lucy?
Yeah. They're just using saying that type 3 is just what this article is talking about, the issue of dementia with the connection. So we said type 1, type 2, and now using the slogan type 3 diabetes. It's
Yeah.
not generally accepted, but it's a term that I've heard used on several occasions associated with this.
Well, it's confusing enough. I don't see a reason to make it even more confusing. But anyway, we have that tendency, though.
But I think it's the importance of, we used to say type 2 was a little sugar.
No, some said that. Doctors never said that. Some said that. But that's an interesting term that people used to use, a little sugar. Yeah. Okay, any other comments or anything else to share?
Dr. Calendar, one time I was in church and somebody just remarked, they said, well, what's wrong with him? He has a black man's disease. Has anybody ever heard that before?
I had not heard that.
I
Which
have.
you have?
Yeah, black man, you have, of course, you have hypertension, you have diabetes, and now associated with that, dementia. Again, it's street slang that, as Dr. Calendar has mentioned, isn't helpful. because it's so prevention and having a healthy lifestyle is what we're all doing with
And
our
it's
discipleship.
what is not associated with Black people. They're saying that's what the impression is, that we don't have a healthy lifestyle, and therefore we have those diseases. That's
Right,
what
and the other one that was included was obesity.
you're right. Which
Correct.
right. And this article talks about cardiovascular health, a major risk factor, recognizing that when we talk about cardiovascular disease, we're talking about arteriosclerosis, as well as hypercholesterolemia and all the other aspects, all of it contributing to cardiovascular disease, which is, with all of its concomitants, a reason why, probably number one reason why people die, cardiovascular disease.
And when we bring in the issue of so many of the stressors caused by white supremacy and oppression and things of that nature.
You know, it's interesting that you would say that, because, you know, there's so many stresses, you know, and the thing that impresses me is that you see so many people killing themselves. And I think one of the main reasons people kill themselves because they think they are valueless. And when someone thinks that they are no value, they don't see the point of living. And so having a reason to live is an important aspect of being relatively stress-free. And that's one of the contributions to longevity, is the ability of, through meditation and other methods, to value yourself and to feel that you're important and that you have a purpose in life. And people who have no purpose in life are those people who are more likely to kill themselves. And we have an epidemic of suicide now in Black people and white people. And of course, the fact that we have grit and we've had adversity, and in spite of the adversity, we've survived is an amazing situation that allows us to feel we're important in spite of the fact that we are stressful because of our complexion and other factors. Any other comments on the stress factor? That's an important one. Jacobin?
Yes, sir. I hear a lot of people say, I don't have Alzheimer's, I have dementia. Uh, 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 Many people think that they coincide, and many think it's different. Could you explain that phenomenon, please?
Yes. Dementia means that your brain is not functioning well and you're not able to perform your normal activities. About 70% of the dementias that exist, which mean, and all dementia means is that your brain is not functioning right. And 70% of those people who have dementia is related to Alzheimer's. But there's another 30% of brain dysfunctions that are caused by blood vessel issues and other issues that are not Alzheimer's. Alzheimer's is a particular type of dementia in which you actually die as a consequence of it, because your ability to swallow and other things results in your asphyxiation over long term. In contradistinction to a situation in which you just have brain dysfunction, but you are able to eat and drink and not have that, not suffocate from the fact that you can't swallow and all those things. So there are different types of dementia. Alzheimer's is one of those, but Alzheimer's is the one that is associated with death because of the inability to swallow and have normal, in addition to memory loss, it also is associated with the lack of the muscular ability to swallow and often results in death from asphyxia. Does that help you understand to some extent?
Yeah. Yes, sir. Yes, sir. I'm quite aware of that, and that's what I thought with the Alzheimer's. Their body functions that deteriorate, the mobility type dysfunctions seem to be enhanced when it's Alzheimer's. So thank you very much.
Sylvia?
Doctor, good morning, everybody. Dr. Count, is there anything that can be done to strengthen the muscles in the, for the swallowing?
No. No. The real truth of the matter is we don't have a treatment for Alzheimer's yet. That's why there's so much emphasis on prevention, because we don't have a treatment for Alzheimer's. And that, of course, is the cure. And even when we have what we call a treatment, we have a slowing of the process, but not an actual cure or treatment for the disease itself.
So you're saying the muscles with the swallowing are just deteriorate? I mean, that's what I was asking.
Yes.
There's nothing can strengthen the muscles. I mean, like we.
That is correct.
Oh,
That's correct.
okay.
Nothing that we found is able to change the course once Alzheimer's is diagnosed.
Yes, I'm listening to this discussion and I'm thinking about our friend Carol and John and my friend Alfonso Bell, who did have dementia and Alzheimer's, and the nursing home, well, the assisted living place, they described it as he just forgot to eat. Oh, but now I'm listening to you, and it's really he's maybe didn't forget to eat or swallow. He just couldn't swallow.
That's correct. That's correct.
And that makes a big difference. But what they were saying at the time was the patients just forget to eat, but that really is not the case. And
That's correct.
that's
And because of that discomfort, they don't want to eat.
yeah, because I know my mother-in-law, she used to just hold the food in her mouth.
Right.
And it wasn't because she didn't want to swallow, she just couldn't swallow, which is, yeah. So that's a big difference.
Yeah. Okay, any other comments or questions? Sylvia, your hand's still up, or you have another question? Oh, okay. Well, this is an article that emphasizes the role that we play in decreasing, normalizing your blood pressure, just as with diabetes, normalizing the blood sugar, and also doing the other modifiable risk factors for dementia. But particular attention is paid to the fact that hypertension, high blood pressure, is one of the modifiable factors. And so just with diabetes, you have to normalize your blood sugar, cholesterol, you have to normalize your blood cholesterol level, vision, normalize your vision if you can, hearing, get your hearing normalized. Similarly, with hypertension, getting the blood pressure lowering becomes a public health priority, because we recognize that in spite of the fact that we have treatment for hypertension, people are still dying from cardiovascular disease because the blood pressures are not being controlled. And so the importance of not only having hypertension treatment, but having the blood pressure control becomes extremely critical. And if the blood pressure is not controlled, then the incidence of the Alzheimer's and other such diseases remains unchecked. Any comments or other questions about the emphasis of cardiovascular disease and hypertension, et cetera, in the causation of dementia?
Show you how it moves into the Gulf. We'll do that next. Right now it's 6:41, so we get to the drive-in. We have some big facts.
Okay, this is a good graphic.
Dr. Callender,
Yes.
I'm sorry. I thought there was someone else talking. I am the POA for a friend that's in a nursing care facility, and recently she had congestive heart failure. They found her holding food in her mouth and that sort of thing. And she has all of the classics, the diabetes, the hypertension, and she's immobile, except with her hands and arms. So this not being able to swallow part, does that contribute to the congestive heart failure?
No. The
Okay.
congestive heart failure is a separate entity. Because
Okay.
there is a treatment for congestive heart failure. There
Mhm.
isn't a treatment for Alzheimer's, but there is a treatment for congestive heart failure.
Yeah. Okay.
And no, dementia does not contribute to congestive heart failure, but it does contribute to the asphyxia that is associated with the inability to swallow.
Okay. Thank you.
Okay. Well, we're finding all of the factors, of course, ethnicity. We know that women and Black people are higher incidence of dementia, as well as dementia risk factors. And this article, one of the problems with some of these articles is that they occur in a lot of different locations. And I think this article had 12% Black people. And it looks at all of the factors that modifiable risk factors articulated up here. And it points out that ethnicity is a factor as well. And it's nice. It's nice to see that they're no longer talking about race, because we're all the same race, but we are different ethnicities, and Black ethnicity is associated with higher incidence of dementia. And what this means is that all those risk factors that you have highlighted there, we have Black ethnicity need to do what we can to normalize those factors so that we can decrease the inordinate incidence of dementia in our population. Why women have it more than men, it still remains unknown. This is an interesting article that lets people become aware of the medication that increase blood glucose levels. At the top are steroids. While that's a marvelous drug because it prevents rejection and many other things, it is one of the commonest drugs that elevates the blood sugar. And people who are on steroids often have hyperglycemia, high blood sugars, until they have a markedly reduced dose of steroids. But it is a wonderful drug, but it also causes high blood sugars. Second is the antipsychotic medications, which also can decrease the ability of insulin to be effective. And because of the insulin resistance, increases the blood sugar. So people on antipsychotic medication have to be careful about their blood sugars. And then, of course, people who take diuretics for hypertension and other things, it also can cause elevation of blood sugar. And then the statins, which are important part of cardiovascular disease treatments, preventive treatments, can also elevate the blood sugar. And then finally, beta blockers that we take for treatment of blood pressure and also for heart failure can be causes of high blood sugars as well. So if you're on these medications, sometimes they may contribute to your diabetes or blood sugars being out of control. Then there are other medications, but those are the 5 commonest ones. Those people are on HIV retroviral therapy and other immunosuppressants also associated with high blood sugars. And then, of course, people who have prostate disease, whether it's benign prostatic hypertrophy or cancer, have some androgen deprivation therapies that may also elevate blood sugars. The one thing that's positive is that these drug-induced diabetes are reversible by decreasing the dosage on these medications. So it's, if you have them, they are reversible. So, which is good news. Any comments or questions about these medications that are associated with elevating blood sugars? Okay, well, I guess we can go to the next article. Well, it's probably a good thing that naloxone prescriptions we use are increasing, because that's the antidote for many deaths from overdose. And what this means is that many of our youth are on drugs, which is not a surprise. But anyway, it's something that has been observed, and your children and grandchildren should be happy in a sense, because it saves lives. Keeps people from dying from overdoses. Any comments or questions about that? I think that's pretty clear.
It's been a long time coming. We've known this for decades. But, as you said, grateful that it's out now.
Okay. Next article, please. It's interesting that we talk about proton pump inhibitors for indigestion and drugs that are associated with esophageal dysphagias. And what this article is saying, that the people who take these medications, who have acid in the stomach, they have higher mortality rates than people who don't take PPIs. On the other hand, if you have a lot of discomfort from these disease entities, it does relieve the pain associated with it. And so this doesn't mean that you should not take your medication, but it just indicates that Uh, as we know, that all drugs have some side effects, and one of the side effects of these drugs, which are very useful, is that they are associated with a higher mortality rate, and so you should be aware of it. Which doesn't mean that you don't want to take it, but it just means you should not take it any more than you have to. And the heartburn or reflux symptoms that are not that you don't want to live with, but it's also a treatment that you take as long as you must, but take a small dose that is possible, smallest dose possible for the shortest period of time. John Buchanan first, and then Dr. Perez.
Okay, yeah, so I was on omeprazole, Prilosec for years, probably 3 years. And I switched primary physicians. He put me on famotidine, and I don't know, is that the same class of drugs?
Well, they have that is I'm not sure about whether that's the same class as the traditional PPIs. I'm not sure. I'd have to look that up. Famotidine. I don't know. I have to look that up.
That's the reason that because we had discussed this over a year ago, I think, and
Yes.
so I was concerned about it. I did ask my doctor about it, and yeah, so I'm thinking that it may be a different class. Thanks.
Dr. Perez?
Same on the same order, because like you said, omeprazole, which is now over the counter. I have an esophageal hernia, and so sometimes it is very, very uncomfortable, especially when I don't adjust my diet. But knowing that the relief of heartburn can leave me demented in renal failure and death makes me a little bit more tolerant of my heartburn, and also to be more responsive with changes in my diet. And I have a real concern. I know I have been on omeprazole for 3 weeks, then off, taking the famotidine, which I think is like Pepcid, and it doesn't have the same risk factors, but it also doesn't give the same continuous relief. And so having an over-the-counter medication like omeprazole without the knowledge of how the risk factors can impact you, or without any packaging demonstrating or emphasizing that if you have diabetes and hypertension and cholesterolemia and all of those things, this might be a medication that you have with consideration of your physician. And so from a personal testimony, PPIs are far more, they are a greater risk than the discomfort from my heartburn.
Any other comment, or Sharon?
I had another comment. So I'm with Kaiser, and I used to get Prilosec as a as a prescription. And then they said, okay, we're not going to give it to you as a free prescription anymore. You'll have to get it. It's over the counter. So that's when I, started buying it at the grocery store or the CVS. And then, it came up, like I said, it could have been 2 years ago where it came up that Prilosec could affect your liver function, long-term use of it. So thank you.
Okay, any other comment? If not, we'll go to the next article. This is an interesting article that talks about sexual behaviors. They're talking about rough sex practices that are associated with sex choking and strangulation and all kinds of other things that people do while they're having sex. Some people find this arousing, and some people find it not so. And some of even think that you can have a stroke as a consequence of the strangling or choking that one may do during the practice of sex. And so there are many other things that people do that are traumatic during sex, and some people find them, but they are dangerous nonetheless. And so they are suggesting that we find other ways of having our sexual releases. It's interesting that this is rarely discussed with physicians, and so this is one of the few articles that I've seen that actually addresses the abuses that or the traumatic things that people do during sexual intercourse. People ask you, do you have sex? They don't ask you, do you have rough sex practices? But some people do other things, as you can see here. Hitting, spanking, and all those other kinds of things. I wonder how many of your doctors have asked you about your abusive sex practices. Dr. Perez, your hand's up.
I am so proud of you, Dr. Callender, because this is such an important subject, sex, especially with the drugs that are out there, especially men who, just having the discussion with mature adults is important. And and I'm proud of you because it's very, very important there. I have discussed with women who are in new sexual relationships, and I think they're pressured into things that they don't all feel comfortable with, and having a physician to discuss it and being knowledgeable about some of the risk factors are also very important.
It's interesting that they said that 64% of people are engaging in these types of activities, which is shocking. Carol?
Dr. Callender, I must commend you. You're one of the few, if only, doctor I've ever heard that talks about sex or asks about sex, period. I don't know how many on this group session, when you go for your physical exam, I never heard of a doctor ask you about your sex or what type of sex. They don't talk about anal sex. They don't talk about they don't even mention the word sex as part of your health. And we've had several articles about that how, we even talked about people that were in nursing homes and et cetera. So before you ask, which doctors, I don't think doctors in their training are even queued up to ask about a person's sex life or what type they're having, or can it be hazardous?
Your point is well taken. Your point is very well taken. And that's an area that we are poorly trained in, if at all. Any other comments?
Yeah, conversations about sex. It's great if doctors would ask probing questions about sex, and the real kinky, dangerous sex is being done by our grandkids, and we're kind of doing the ostrich approach if we think that our grandkids aren't sexually active, and if we're not talking to them about sex, their computers and their phones certainly are. And their computers and the sex, it's not just rough sex and choking. There's also anal sex. There's what they call tossing the salad, and that's licking the anus from both men and women doing it. So there's a lot of dangerous practices that, it's high percentages. It's imitation. Not only is the internet raising our kids, you could say that our kids are being raised on porn. And if we're not talking to our kids about these dangerous practices, then the internet certainly will.
Well, thank you for sharing, because it's important for us to understand that. Any other comments before we move on to the sexual arousal cream?
I have one more. To answer Daryl's question, how can you talk about something you know nothing about? I don't know if doctors, what they really know. I had an experience once in my life where I was a counselor and I had to do sex education. Well, I became educated myself, and then I had a Sunday school class, and kids would ask questions. They have questions, but they don't have anyone to ask them to. They ask, is oral sex really the same as regular sex? Because are you still a virgin, and etc. They have these questions, but there's no one there really to answer. And then they don't want to ask it if they know they're going to be down for doing it and that they're sinning and all that kind of stuff, because churches are the last places to talk about that, because it's just plain bad. Don't talk about it. But they're as far as education, I don't know how much doctors really know, but etc. You can't talk about something you don't know. And you just informed me about tossing the salad. I never heard of that before, but I guess everybody else on this group session has heard about it. I have to say, I'm old. I know I'm not elderly yet because Dr. Callender didn't clarify what is the age of elderly. My children think when you're 60, you're elderly, but I know on this group section, I am a young thing.
Yeah, the term tossing the salad, that comes out of the prison experience, and so there's a lot of homosexual forced sex in the prisons. And what a dominant male will do to a newer inmate is make him toss the boss's salad. And that's more of a subjective process that can break down somebody more than just homosexual sex, because that's just something you never forget. But okay, it's not that you actually have to practice these things to school your kids. It doesn't
That's
need
right.
firsthand experience, but they believe the internet. You point them to the internet, and you say, okay, here's information you're not giving. Here's a danger. Here's all the type of physical disorders and problems that you can have with these unsafe practices, and they'll believe that. But all the garbage that they're on the internet is not, it's not showing the downsides. It's not showing the health deficits and problems of these practices. It's just saying, do this and you'll be a sexual star. You know, show them the downsides.
What role should the churches play in sex education?
I personally, I don't know. I think the churches should get into somewhat talking. They should supply some sort of resources. And I mentioned before that when our Christian education director asked me to do a sex class for young girls, I was a young mother, divorced parent, and she asked me to school the young girls, and all I could talk about, as Carol said, is what I knew. So I told them about contraception and trying not to, you know, what the religion practices, trying to save yourself to marriage and this type of thing. But I think at this stage of the game, and like Darrell said, what's out there for children to get now, it needs to be a trained person who really can tell it like it is, so to speak. And I think church is a great avenue for that if they would do it.
Do we do it?
I object. There's no more such thing. People they're not going to church. Children are basically not going to church. There's no more Sunday school. As far as teaching and all of that, Dr. Callender, maybe your church is different.
Yeah, we
But
still have Sunday school.
the venue as far as teaching about sex is mainly older people, my generation going to church. The younger generation, they'll go to these great big mega churches. But as far as the teaching relevant of what churches used to do, it's no longer, what I have seen is no longer there. You just go on Sunday morning as far as the sideline of teaching, whether we used to have BTU, Sunday school, and all that kind of stuff. There's no venue as far as teaching, and it's little as far as just worshiping. So
Well, there should
I
be.
don't know where they go to learn.
Yeah, but they should be. If the church isn't doing it, then Darrell is right. Internet is doing it. So if we're not going to do it, it's not going to be done well. So one of the things that should be explored is that the church should be teaching sexual education as well.
You know what? To Carol's point about how can you speak about something and talk about something that you know nothing about.
Well, you learn about it. You read about it.
You just ask an expert, a person who's an expert at doing that, like me.
Right.
You know, a person who can talk a lot about something that they don't know nothing about. Just ask an expert. And as far as the church is concerned, girl get pregnant before marriage, kick them out of the church.
Mm-hmm.
Well, anyway, I think there's an opportunity for sexology to be taught in the churches, because this is an area of humanity, and as Darrell has expressed so beautifully, if we're not going to do it, the devil will do it. Lucy, you're next.
As you said, it's something about honesty. Adolescent medicine physicians talk about sex. And at the hospital where I was at, there were so many international physicians that had many cultural differences about sex and really didn't appreciate sex and its issues in the hood in North Central Brooklyn where I was practicing. And so my Friday adolescent clinic, I had a commercial sex worker come in. Okay, I'm always on the far left, and talk about how to put a condom on during oral sex. Because the young ladies were being coerced, and I saw that in teenagers, but from the women's ministry currently in my church, there are a lot of older sisters that are coerced into sex, that are in new relationships, or their spouse or significant other has gotten treatment for their dysfunction, and now are all alive and engaging and pushing. But the issue of sex is a very personal issue in human development. That's how we all got here. And we all got here by this manner and the miracle of Jesus. And what his mother went through because of it is millennia long. So it's important. It's important for approval for some of our mature, not elderly, members of this group to feel comfortable in that kind of discussion. Just like we did with HIV, beginning to have these conversations at dinner. At dinner. I mean, I'm sure your young people will then know that you're a venue that they can go to talk about. I can't tell you how many young teenagers I brought up to manhood where they didn't know what was happening, having emission at night, and what does this mean if I get hard, does that mean I'm in love? Because no one is having that discussion. That was something that I appreciated about the Huxtables, because I could see two happy, married Black people hugging each other, pinching each other, tapping each other on the behind, versus spanking and tossing salad and putting objects in, which turn into orphy, that are operations or strategies of superiority or power. And those kinds of things have to come into intimate relationships. What are we doing this for? Why are we doing it? Why was it given a gift to people who have committed covenant with each other? But if people don't know that it's a subject matter that can be discussed, as Dr. Callender has opened for us, he is a trailblazer in so many ways. But if you talk about masturbation or mention it at Thanksgiving dinner, I'm sure you'll get more texts from your young people. They'll say, "Hey, Nana Lucy, you were talking about, So anyway.
Okay. Jochebed, you're next.
Yeah, thank you. And thank you so much, Dr. Lucy. I'm concerned about this subject, not from the fact that I'm an old woman, but from the fact that here we are removing books out of the school, educational books. And I like what Daryl said about the computer has taken over instruction for our children. They even have internet classes and all of this stuff. But if you bring sex into the mix, then they're going to put you in jail or throw you out of society or whatever. It's a no-win situation as far as I can see.
Darryl, you're next.
Situation.
Darryl, you're
Okay.
next.
All right. You know, the question was that we never did answer is probably because we can't. Should the church get involved? And, you know, the church, the official position is that premarital sex is a sin. So that's kind of hard. But when you're talking to somebody about sex, you really can't have conversations unless nobody's a judge. And you know, if you start making judgments in a sexual conversation, people don't talk; they withdraw. So everybody likes to abdicate responsibility if they can. Parents like to say, "Let the schools do it." Okay, schools stop doing it. Let the church do it. You know, let the doctors do it. Doctors aren't judges, but they can't have the conversations often enough. So that's a real shift. You know, you raise a child um, from 0 to 13. Say your child is not sexually active, but from 0 to 13, in the process of raising that child, you've been the child's judge for 13 years. And so somehow you got to do some jujitsu and flip that around to when they become sexual active, that you can have a conversation without being their judge or the child regarding you as being a judge, so that they can open up and you can have a free conversation without you being their judge. So that is all the reasons why I never had any children. Good luck to all you parents and grandparents, because you got the toughest job in the world that I wouldn't approach with a 10-foot pole.
Well, one of the problems is that they have sex before 13.
That's the sad part.
Yeah, they have sex before 13. So, you know, 9-year-olds have sex. And so, Carol, your hand is up.
Again, Darryl is absolutely right. We're judgmental right now when you say that a 9-year-old is having sex and someone said that's a sad part. Right then, once a child or a person hears that, then we're doing a judgmental, and that person's going to clam up. Adults can't even talk to each other about sex. We are, even on this, we could talk about others, but you can't talk about yourself. We're so judgmental. I came across of an older woman having porn, and I was sort of curious about, you know, do women look at porn or do men look at porn? We are so judgmental, and I'm just curious, is that a usual behavior? But we were taught to be judgmental, you know, to be shamed. That is the worst thing to do, is to have sex or even talk about sex. And Dr. Perez was talking about mentioning it at the table. People don't want to talk about that at any function, whether you're at a party, at a table, dinner table. Dinner table is the worst time to talk about sex. So that we are a judgmental. So I don't know, in this society, and I don't know what society, can anybody openly talk about sex except for us right now. We're really not talking, we're talking about others, but we don't talk about ourselves.
Well, you know, sexology is the study of sex. So if you were to do it in a non-judgmental fashion, as Darryl mentioned, it would work. The question is anybody willing to do it in that fashion? Betty, you had your hand up.
Yes. Well, I'm going back to me as a child, and the fact that I don't know about my sister, but I can say for myself, my parents never talked to me about sex. I learned in school, which now they don't, I'm sure, tell the parent. One of my teachers talked about it. But, and then when I came up in church, so that's my point of contact, that you didn't have sex until you were married. Of course, that went out the window because you have the hormones and stuff like that. So, you know, you aren't thinking about that when those things are occurring. So when they asked me to teach the class, I just merely told them my feelings and what I did and what I did not do. And I confessed that I had sex before marriage. And I told them that it was not the best thing to do because once you start, there's no turning back. But so, and I think the children were appreciative and they came to me individually and asked different things and I tried to explain it. But as Darryl said, today it's just so much out there that I think if a child is in church or if the parent is in church, I really personally think sex should be talked about at home first. But if the child is going to church or the parent, then the instruction should start there because I feel like that's the appropriate approach, the church's approach, which is not going over well today. But I still think that's the appropriate approach for sex.
Okay, okay. Well, why don't we have Lucy, your hands up again, have closing comments as we move on to another subject. Dr. Perez?
Just our judgment on sex and sin. You know, lying is a sin.
Okay, all right. Well, I raised the subject because I think it's a subject that needs to be raised in all spheres. And just as many of you, my parents told me nothing about sex. So I even got into a fight with one of my schoolmates because he suggested that my mother and father had sex. So that I was totally ignorant. And so I think that should be done away with, that sexology should be taught just like anything else. But let's move on. We've talked about that for probably long enough. And I think just bringing it up was worthwhile. This is an article that talks about sexual arousal cream, which is really sildenafil, which is, of course, the medication that causes men to be able to have erections and hard-ons, etc. And this cream has been used successfully in some women to arouse their sexual interest. Decrease of sexual interest or libido is something that we have discussed in some of our groups before, recognizing that most intergender groups are not well equipped to talk about sex because men lie when they're around women, and they tell all kinds of tales and lies. So therefore, when we had the sexual discussions, they had to be gender identical because otherwise you have so many lies that it's just useless. But we've gotten away from that, and this is one of the first times we've talked about sex in this group in a while. But the point is that there are some trials in which these creams have been able to allow for some women to have sexual arousal. We won't even talk about the fact that in some cultures, as you mentioned, clitorectomies were done so that the women could not enjoy sex. And so those are subjects that are really part of sexology, that the pros and cons of all of these aspects should be discussed in some forum. Of question is where the forum is and where you can have a forum in which is not judgmental. Moving on to the next article, because this will be the last one. When is sexual behavior out of control? And that, of course, is a question that what is sex addiction? How many people have sex addiction? And if you don't have any understanding of sexology, you can't understand about what sex addiction is. Sex addiction is a disease which exists, or is a condition which exists, which we don't talk about either. Whether we talk about for males, we think it's okay to be a sex addict. For females, we don't think it's okay. And that's the judgmental aspect of it. So who is calling who abnormal and who is calling who normal? And these are some of the issues that we rarely discuss, but I put it in this article so that we would at least recognize that this is a subject that needs to be discussed somewhere, somehow. We've seen situations in which certain people have admitted that they were sexual addicts. Tiger Woods said he was a sex addict, but it's rare to have somebody to admit that they are a sex addict or that there is such a disease, such a compulsive sexual behavior. Anyway, I just put this article here just so we would not be totally ignorant about sexual behaviors. Any comments or questions, as this would be the last article of the day?
Dr. Calendar, we have two guests on today. I think one guest may have been here before. We have Freddie West, and we have somebody.
Fredette West, yes, Fredette West, you still there?
And we have an MP, somebody who signed in as MP.
Yeah, well, okay. Fredette West or MP, are you willing to say hello to us? You're welcome, whether you say hello or not. So we're glad you could come.
Fredette might have problems with her audio.
Okay. Well, we're glad that you joined us.
I think it unmuted. Can you hear me now?
Yes.
Yes.
Well, first of all, thank you. And thank you, Lucy, for reminding me. I was deep into something else. But I just wrote down thoughts as you all were going through. And it's good to see you again, Dr. Calendar.
Long time no see.
It has been a long time, but it's always like when we do talk, it's like we saw each other yesterday. And that's a good thing. That's a real good thing. But so many things crossed my mind as you were doing that, during the discussion. You know, like we're seeing more advertisement to younger and younger people about these erection drugs, medications, whatever you might call it. And things can get so far out of hand that you can't pull them back. And at some point we have to look at what's the long-term or even short-term implications for young people using some of these things. And I think we all could have anticipated that's what they would do at some point, because it's all about the dollar. So those types of things. Like I said, just so many different thoughts, and I appreciate being on and the discussion and just all of it. And
Please come again.
you're pointing out too, with regard to teaching sex education, what's the cost of not teaching it? And AIDS forced the door open, whether it's at the dinner table or the bedroom. And so it's just the whole mix. We have to think about now, what's our responsibility and how do we bridge that with young people? Thank you so much, always.
Thank you, and please come again. MP is gone. MP is gone, but anyway, for that, it's good to hear your voice again. You know, I can't see you, and we've had many years of working together, so
yes, indeed,
it's a joy to
same here.
see. Yeah. Okay. Well, we had a great discussion, shared a lot, and as always.